Hi, I'm Arthur Grimes. I'm in Wellington, New Zealand. One of the major issues that we have in New Zealand is poor housing quality, and it especially affects people, of course, who are in the lower part of the income spectrum or otherwise who are disadvantaged. One of the policies that we've been experimenting with recently is a housing first policy modelled along the lines of those in California and other jurisdictions. The evidence linking poor housing through to poor life satisfaction of people is increasingly strong. In New Zealand, there are two studies making this link. One is showing that people who move from poor quality rental housing, private rental housing, into public housing have a lift in their life satisfaction. And a second study that I've been involved in with a graduate student, Leah Haynes, concentrates on women who have dependent children who are in hardship. If we look particularly at sole parents, at sole mothers, we see that those who are in poor housing conditions have a 60% likelihood of having low life satisfaction. And that compares with a proportion of 30% if they have good housing conditions. By contrast, if we look at, say, mental health and especially depression or anxiety, we see a similar number of sole parents who have very good mental health having low life satisfaction. So roughly 30% of sole parents with good mental health have low life satisfaction. That rises to a little over 40% if they have poor mental health. So what we see is the effect of moving into poor housing is a much larger effect than the effect of moving into greater anxiety or depression. So quite clearly, housing is strongly associated with low life satisfaction, and so moves to improve the quality of housing for people such as sole parents who are currently in hardship have a lot to recommend them as a policy focus. Thanks.